There's three things we consider when evaluating someone for pancreatic surgery for pancreatic cancer. The first of all is whether the patient's fit enough to undergo the type of surgery we're proposing. The second lot is the technical aspects of the surgery, what type of operation we're going to perform, and how it fits into other treatments. And the third thing is a holistic view as to whether the patient actually wants to undergo this sort of treatment.
So recovery time will be dictated by types of surgery. Generally speaking, pancreas operation requires probably around 5 days to 2 weeks of stay, depending on what kind of operation you're having. You're having open surgery, you're having keyhole surgery, whether you're having a right side pancreas operation or left side pancreas operation. If you have a keyhole surgery, your physical recovery is very quick. I would think you are walking around next day, and then after you go home, you might be able to do whatever you used to do at home, except heavy lifting and the gym work, that sort of very heavy muscular work.
So when you arrive for your admission, you come to reception and then they will explain where to go to get to DOSA, Day of Surgery Admissions, and from there we will organise your admission. When you arrive at Day of Surgery Admissions, or DOSA, you will be greeted by the receptionist, who will then organise your folder and send it through to the business offices. And then from there, one of the nurses will call you through into one of our admission rooms, and we get you admitted, do all your paperwork, check your health history, do your blood pressure, temperature, make sure any pathology that needs to be done is done, and we have the results. And if we have any questions for the surgeon or anaesthetist, then we will call them to check that everything is okay with you. From there, you will get changed into your lovely gown and sit in the waiting room, and then go into the holding bay, which is the pre-surgery section for being checked in.
Following your check-in from the anaesthetic nurse in holding bay and meeting the anaesthetist, we'll take you around to theatre. You may go to an anaesthetic bay or directly into theatre, where you'll typically have an IV inserted, and you'll meet your surgeon and the scrub nurses, which there'll typically be two, a theatre technician as well, and we will commence your anaesthetic. Following your surgery, you'll come out to our PACU, which is our post-anaesthetic care unit. From there, the anaesthetist will hand over to your recovering nurse, who will monitor your vital signs throughout your stay there. So we will be looking at blood pressure, heart rate, temperature, and treat any discomfort or nausea that you might have.
On discharge from hospital, we would hope that you're eating and drinking an adequate amount and you can be looked after with all your daily activities. Over the coming weeks, your strength should improve, and hopefully by the 4 to 6 weeks, you're back to your baseline level of functioning. You can have a lack of appetite, and often people are eating small meals regularly. This will change, and you eventually will get back to a normal diet as well. Many people will go home on pancreatic enzyme supplements to aid digestion. This is Creon, and you need to learn to take this at the start of every meal. The muscular healing continues over up to 6 to 8 weeks. We'd encourage you to resume activities early, such as walking and low impact aerobic exercise.